it's Catherine Maley, author of Your Aesthetic Practice and president of Cosmetic Image Marketing. And today's question is, Dear Catherine, I have a nice office, great staff, and we like our cosmetic patients. The problem is in getting our new patient consults to say yes to plastic surgery. Now I'm spending up to an hour with a prospective patient, and then my coordinator spends time with them and they still don't book. More and more, I will have a full day of consultations back to back and not book surgeries or other big ticket procedures. What a waste of time and energy. My consult conversion rate used to be in the high 70s for years, and now it's fallen to 25 to 40%. So he asks, is it me? Is it my patient coordinator? Is it the patient? What can I do to convert more of these surgical consultations? Signed, Dr. A. Dear Dr. A, thanks for a great question, and you're not alone. Lower conversion rates are affecting more and more cosmetic practices. It can be so frustrating to put so much effort into the aesthetic patient consultation and then get nothing back in return. It can also be costly when they don't book, because the difference between a 30% conversion rate versus a 50% conversion rate can easily add up to hundreds of thousands of dollars. Now, the reality is your efforts don't count until the patient says yes and pays for your services, right? So here are 3 ways to get more prospective patients to say yes rather than, I gotta think about it, or I need to talk to my husband. Here's number 1. Get the right patient coordinator in the position of consultation closer. Now, your coordinator must believe in you, your skills, as well as cosmetic rejuvenation. If your patient coordinator would never succumb to this world of cosmetic vanity, how the heck are they supposed to promote you and your services? You're looking for someone excited about this industry. And it's even better if they've had work done by you, because that turns them into a walking, talking testimonial for your expertise. But they also need powerful people skills so they can quickly bond with your patients. Just be sure you have the right coordinator representing you who looks, acts, and feels the part. Here's number 2. Give your patient coordinator the tools needed to bond with the patient. Consider what a difficult conversation this is to have with a complete stranger. The cosmetic patient is uncomfortable with their appearance, so they're feeling vulnerable and anxious. Now, the coordinator's job is to put them at ease and reassure them that they're in the right place and they'll be happy with the result once they decide to move forward with you. Now, your coordinator must have a process set up and powerful questions to ask, as well as tools to use to help the patient articulate what they want, why they want it, and what it will take for them to say yes. Now, one helpful tool is the initial cosmetic questionnaire that helps get the conversation started. So it's a checkoff list of concerns the patient has rather than your menu of services. Think problem first, then solution, because that's how your patients are thinking. And number 3, script your patient coordinator so they know how to ask for a decision. So many practices have patient coordinators who are nice and they look the part, but they have no idea how to ask for a decision professionally and confidently. Now, this one skill makes the difference between a 25% conversion rate and a 75% conversion rate. But like anything else in life, it's a learned skill. It takes proven strategies and practice. For example, a trained and skilled patient coordinator is never pushy or aggressive. They have the words and the scripts and the processes they need to lead the patient to a decision that is comfortable for the patient. For example, a simple closing strategy is the choice close. That means rather than the patient deciding a yes-no question, they are choosing either or, and yes is assumed. Like this: Sarah, Dr. Smith's surgery days are Wednesdays and Fridays. Which works better for you? Now Sarah has most likely moved from if she's going to book to when she's going to book. It's a small nuance with a big effect. Try it. Again, the right patient coordinator who is trained and given the right scripts and strategies will be a game changer for your practice revenues. This position should never be taken lightly or your revenues will suffer. I hope that helps, Dr. A.